So good morning. I am Dr. Joyal Shah, cardiologist at EPIC Hospital, Ahmedabad. So we would like to discuss you about coronary artery disease. So what is coronary artery disease? Coronary means the heart. Arteries means the artery which supplies blood to the heart, and the disease which occurs in the arteries which supply blood to the heart is known as coronary artery disease. Now, basic and the most common cause of coronary artery disease is development of cholesterol blocks inside the artery. So that is these are the fat blocks or cholesterol blocks which we can normally relate. So what happens that basically whenever the cholesterol level rises, it starts get depositing in the artery walls. Initially, it accumulates inside the walls, then gradually it expands and it comes inside the lumen of the artery, and whereby it blocks the blood flow of the artery. Now what happens is, once the lumen diameter decreases, the blood flow to the heart decreases and it can cause angina. So angina, what I can say, is a precursor to the heart attack. What is heart attack? Now you get a heart attack when the blood supply in the artery or the vessel or the tube ceases to 100%. So the artery is blocked. Now how this happens? So whenever the lumen is occupied by the cholesterol block, there is a coating which prevents blood to clot. Now once the cholesterol blocks increases and it ruptures, so that the coating is disrupted and the blood starts clotting on it, and it will occlude the artery and thereby lead to the heart attack. Now why we should worry about the heart attack? So angina causes disability, morbidity, but heart attack can lead to death. And if not treated in time, there are 30% chances that you might end up with consequences. Those are very bad. It can lead to death. So every cardiologist practice in a way that they want to prevent the heart attack. Now, so once the diagnosis is made, so how the diagnosis is made? So we divide this into two parts. Certain times patient comes with us with a heart attack onward, or he comes after heart attack, and certain times patient comes before the heart attack. So both the line of treatment separates. Now, if you think that we have to prevent the heart attack, so there are various treatments and various diagnostic tests. And if you come after heart attack, there are certain different tests, certain treatment modalities which keep on changes. So first, we basically, whenever a patient comes for a screening, suppose he's a normal healthy person and comes for screening, then you do various tests. Those tests are like, you get a ECG done, that's a cardiogram. Second, you see the echo, so you see the structure of the heart. Third, you subject him for a stress test. There are various types of stress tests, like treadmill test, echo stress, or nuclear test, which leads to nuclear stress test. Fourth most modality is now is a CT calcium score. So you subject the patient for a CT scan, where the CT scan detects the calcium deposition in the vessels. Now what is calcium deposition? So calcium deposition is the cholesterol blocks which are there, it degenerates into calcium, and then you can see how much calcium is deposited. So these are the various tests, and from where you can diagnose that patient requires certain type of treatment. So this is the basic thing. Now what happens when a patient comes with a heart attack? So when a patient comes with a heart attack, we take the history, we see certain ECG findings, echo findings, and then we advise the treatment. So during heart attack, treatment usually is we have aggressive approach because it can lead to death. So we are very aggressive in that. So we either giving blood thinners, which is we call it as thrombolysis, or we straight away subject them for an invasive treatment, which is known as angiography followed by angioplasty, where you open, basically concept of angioplasty is whatever the blocks are there, you just remove it with a angioplasty and then you put a stent. So that is how the blood flow is restored and heart attack subsides. Now these are the basic treatment where we always consult our patient. Now, there are certain medicines for both after heart attack and to prevent heart attack. So it goes into the then preventive medicines. So basically there are blood thinners, there are certain medicine which reduces the heart rate, certain medicines which reduces the blood pressure, certain medicines which will improve your heart function. So there are various combinations of medicine which we prescribe according to the patient's subset. Now, apart of this medicine, there is another concept of lifestyle changes. So we advise a good diet. We take the help of a dietitian so that patient is formed into the diet compartment. Second, healthy lifestyle in the form of yoga, exercise, according to the patient's subset. So it's not that a patient comes to you, you always advise him he has to walk for at least 1.5 hours a day, or he has to cross this exercise limit. It all depends on individual patient. A weak heart patient cannot do heavy exercise, and a strong heart patient has to do heavy exercise. So it's a subjective exercise prescription. So it keeps on changing. Second, you have to focus on the associated diseases, like patient is having thyroid, like patient is having diabetes, kidney diseases, and neuro diseases. So there are a lot of other comorbidities which patients usually have, and we try to control those comorbidities which indirectly or directly affects the heart issues. So overall, a comprehensive care is needed, and it's not a one-way approach that patient has come, who get an angio and get a stuff, fix it. It's not like that. So it has to be a comprehensive approach right from the patient history till his preventive medicines. So everything has to be looked upon it and it has to be treated. For this, you need a team, you need proper infrastructure, you need proper patient compliance. So everything has to be in a place to get a perfect result. So if you have a team, if you have perfect infrastructure like EPIC has, perfect patient counselors, and it will improve the patient confidence as well as his compliance. So overall, a comprehensive teamwork can lead and can prevent certain heart diseases which are very much treatable. Like India is an epidemic of heart disease right now because of obesity, diabetes, hypertension, and lifestyle changes. So we have to focus certain things on it. You cannot prevent which is into your genes, which you have already inherited from the previous generation. That's not in your heart part. But certain parts which you can prevent is the basic thing which we have to teach our patient, and they can easily accept it. So patient and doctor relation is more important in any treatment part, and that we can easily establish with a good teamwork, and which we easily provide. This at EPIC is our patient-centric approach. So we always take a patient into comprehensive look rather than treating a certain problem and just send them back. So overall, as a EPIC team in cardiology, we take a comprehensive approach, including we take the help of PROs, technicians, dietitians, including the good nursing staff, cath lab staff, and everything. So thank you. This is all we can say about the heart disease in brief.